And before doing so, I would like, of course, to thank the entire team I work with in Monza over the last 2 or 3 years, and also Care Fertility UK for sharing with us today some of their data. So what I'll go through is why apply embryo time-lapse microscopy for those that are less familiar with this technology. Spend a few words about time-lapse microscopy devices and the limitation and advantages. And I will go through some intrinsic and extrinsic influences on embryo morphology that somehow may make morphokinetics, in other words, morphology changes over time, more or less objective. And finally, what I would like to do, stress more, is the ability of time-lapse microscopy to predict either blastocystis formation, euploid implantation, and finally, have an impact on clinical outcome. So, there was a missing lecture this afternoon that would have covered the unfinancial consensus about embryo morphology, embryo evaluation. And, but it is established, it is well founded that if we want to better define embryo quality and improve our selection ability, we need to observe embryos at a specific time and correlate those time with the expected developmental stage. But as we have already suspected, few observations at isolated time points are insufficient, in fact, to discriminate difference in morphokinetics of embryos that appear similar, but in fact have a different developmental history and probably a different developmental ability. So the first initial evidence on embryo morphokinetics in clinical IVF in modern times dates back to the 1979, in which Payne and colleagues showed that there was a possibility to make a recording on embryo development, and in fact, in that case, they were able to correlate the early events of fertilization with the subsequent embryonic quality. So there was a hint, a suggestion already at that time that morphokinetics and time-lapse microscopy could have helped us. So we should ask ourselves, why wait over 10 years in order to have a suitable technology that can be part nowadays of our routine laboratory activity, at least in some laboratories. So we have now a number of time-lapse microscopy systems. Companies have become interested in that. And by large, the most popular one is the one in the middle here. For a number of reasons that I'm not going to explain you, but there are advantages and drawbacks in having a single or predominant system, because on one end we can better standardize observation with the same device, same technology. On the other side, we have possibly we have some kind of limitation, and I want to show you what I mean by that. On the left-hand side, we have a recording of very early events of fertilization, polar body extrusion, and initial formation of pronuclei. And the movie is rather kind of not entirely fluid, if you wish, in its progression. But if we look at the same process with another device, which is in fact developed for basic research, we can see a number of fluctuation, oscillation, and waves of the cytoplasm which are missed in the other kind of observation with the embryoscope. So embryoscope is a suitable, very powerful tool, but it has limitation, and we have to acknowledge that. You've seen probably a number of movies, so probably I will not run the entire video, but this is just to emphasize how by time-lapse microscopy we can observe a number of phenomena, of course, that will be missed with ordinary observation, especially in terms of allocating a specific time to a specific event. So what can we monitor by time-lapse microscopy? What we've done with standard observation, but in a much more precise and detailed fashion. So we can observe fertilization events with the, in fact, the delimitation we've just seen in the previous videos. We can precisely determine cleavage times and their intervals, regularity or, in fact, perturbances of cleavage, relative blastomere size, blastomere fragmentation in a dynamic fashion, of course, in multinuclearity, multiple nuclei, in other words, in a single blastomere, and abnormal cleavage, which is a phenomenon that it was suspected to be happening, but not entirely documented. And of course, we can also establish better times for compaction blastocyst formation events, especially during the 9 hours in which embryologists are not supposed to work. So, but there is another question. Is morphokinetics, despite the improvement in technology, an objective criterion to assess embryo quality, changes of morphology over time? In other words, is it affected by intrinsic or extrinsic factors? Here we have a sort of snapshot of pre-implantation developments and different factors that can affect, in fact, embryo development. Some of them are intrinsic, etiology, aneuploidy, for instance, and genotype and its expressions, and other may be introduced by the operator, either clinically or in a laboratory environment. So, what we know about that? First, I'll just mention a recent study in which the authors, a Turkish group, were able to observe and actually compare the effect of different culture media on morphokinetics. And they concluded that morphokinetics of embryo development is faster, in fact, in single medium, at least until the 5th cell stage. So if you compare single medium versus sequential medium, you see a difference in the time at which the various phases of cleavage are achieved by the embryo. So this is an initial kind of bias if we were to compare, say, parameters between different laboratories. We have done some observation over the last year or so with our time-lapse microscopy device. And in this study recently published, we have in fact compared the development, morphokinetics, in fact, of IVF versus ICSI embryos, that from the 2-cell stage to the 8-cell stage. And what you can see here, in fact, initially we have a delay, the 2-cell stage or 3-cell stage times, but this delay is totally eliminated over the following cleavages. And in fact, the similarity is very striking. It's almost symphony. It is as if the IVF embryos, after the initial delay due to the different insemination technique, catch up with the ICSI embryos. So the fact that IVF embryos are developed with a different timing is only limited to the very initial steps. The rest is not equally so. So, can we predict blastocyst formation and quality? There are some data that, and again, according to what we've seen so far, we can to some extent predict blastocyst development. In this specific case, we have monitored cleavage times from the 2-cell stage to the 8-cell stage in 2 different groups of embryo. Embryos arresting after the 8-cell stage, therefore with some developmental ability, at least in vitro, with embryos that were able to develop to the blastocyst stage. And from the 7th cell stage on, we can see, in fact, some differences. So differences are not overt initially. They start to emerge towards the 3rd cycles of division. And in fact, when we compare, according to the same approach, expanded and non-expanded blastocyst, we in fact see a difference. Embryos, they are destined to develop into expanded blastocyst at a given time point, develop faster. So in a way, we can in fact predict blastocyst development and blastocyst quality. And this is more or less what other people have found more or less at the same time recently this year. it's the EV group, and they have already, they also observed a difference in times between non-blastocyst and blastocyst, in favor, of course, of a faster cleavage for the blastocyst embryos with the blastocyst capability, and the same applies to good morphology blastocyst versus poor morphology blastocyst. So we have a gradient of, say, of speed, if you wish, during development in vitro, going from embryos with lower developmental ability that do not develop into blastocysts, which are relatively slow, and embryos which develop to blastocysts, which have a faster pace of cleavage, and this cleavage is even faster is blastocysts in the end develop an expanded cavity. So, can we predict implantation? This is a little bit more difficult question. And according to our analysis, which is very simple, but we wanted to keep things simple, we compared initially transfers in which we assess 100% implantation or 0% implantation. And by that, we were trying to better highlight some possible differences. And we compared the 100% implantation with the 0% implantation, limiting the analysis to only 2 time points. One, the ability to reach the 5-cell stage, and the other one, the time required to reach the 8-cell stage, which we believe is important. And as you can see here, until the 5-cell stage, there is no detectable statistical significance among the 2 groups, but a difference emerges afterwards at the 8-cell stage. So although these are simple individual parameters would not be able to totally predict implantation, it is relevant to this ability. It is also interesting to note here the distribution times of the 2 groups. Here is more scattered, if you wish, in the 0% implantation. There is more clustering in the 100% implantation. And the perhaps more interesting thing is that when you have implantation, you rarely see that embryo develops to the 8-cell stage beyond the 60 hours, which is at the middle of the night, well, 2 or 3 hours after midnight, usually. So perhaps we should rethink either the observation time, which is a little bit difficult for embryologists again, or perhaps reconsider the entire time schedule of an IVF cycle. So perhaps the most important large analysis significant so far that has tried to associate morphokinetics with implantation is the study of the EV group, first author Marcus Messager, and they've gone through a large data set. They've tried to associate implantation with a number of morphokinetic parameters. And what they did was to identify intervals that were associated with a higher implantation with respect to a number of parameters. Time to reach the 2-cell stage, 3-cell stage, and 5-cell stage. So we can see that within a given interval, say for the 2-cell stage, 24 hours, 0.3 to 27.0, you have the better implantation ability. Outside the range, you don't have a 0. You have still some residual ability. So that means that a single parameter, of course, cannot be entirely predictable. And of course, they extended the analysis to other kind of parameters, not only the time of a specific stage, but also the time occurring between different stages. In this case, between the 2-cell stage and the 3-cell stage, and below between the 3 and the 4-cell stage. So putting together these individual parameters in a pyramidal, or if you wish, a hierarchical fashion, they've been able to develop an algorithm that, in their hands, is able to predict the implantation rate of an embryo, depending on whether it is able or not to reach the 5-cell stage within a given range, and assessing to this embryo score, and doing the same thing for the other parameters. So there is an association with a certain linearity between morphokinetic parameters and implantation ability. And I would like just to show a specific case in which we can see how in some cases morphokinetics can be so powerful. And this refers to the case in which a fertilized egg divide directly into 3 blastomeres, as it is shown in this video. And when these embryos are transferred, implantation rate is residual, 2.9, versus a much higher implantation of embryos that do not display these characteristics. So in some cases we have very clear answer to our questions, although these cases are rather limited in numbers. Can we predict ploidy? This is another important question, because ploidy and the pace of development in vitro could be associated. And I would like to describe in this case the data that I borrowed from my ex-English colleagues from Care Fertility UK. What they did was to biopsy by blastocyst and assess the ploidy status of embryos with comprehensive chromosome screening, so the entire set of chromosomes. And they categorized the embryos as a single aneuploid initially, 30%, well, 30 embryos over 98 in total, multiple aneuploidy or euploid. And they assessed a number of morphokinetic parameters, and basically what they found was that there is no significant difference observed in cell cycle length during the first cleavages. So at the beginning, you can't see any difference in pace between embryos that are either neuploid or euploid. But you start to see some differences later on. In red, you have the embryos with multiple aneuploidies. In red lighter, you have embryos with a single chromosomic error. And in blue, you have euploid embryos. You can see that the speed is progressively delayed in aneuploid embryos. So they tried to somehow develop a prediction model by using the 2 most important parameters, the start of blastulation and blastocyst formation. These 2 times are informative in their hands to discriminate euploid from aneuploid. And they put together the single aneuploid embryo with those that had multiple aneuploidies. And so they had 3 classes of risk of aneuploidy arbitrarily, and 2 variables, either normal embryos or aneuploid. So what they found, it's rather interesting. At least it is suggestive of results that we have in the laboratory. In other words, when you have blastocyst formation beyond 133-34 hours, you have a very high risk of aneuploidies in these embryos. Biopsy through comprehensive chromosome analysis. But this is not enough, because if you integrate another parameters, which is the initial formation of the blastocyst cavity, you see another effect. So when there's an initial blastulation occurs later, they say 98 to 97 hours, you still have a relatively higher chance of aneuploidy. And in fact, when these events occur a little bit earlier, the chance of aneuploidy is decreased. So later stages of development in vitro may be in part at least suggestive of the ploidy status of the embryo, although it's not a definite answer, yes or no, of course. So does embryo selection by morphokinetics have an impact on clinical outcome? Data are very scant so far, but there is a retrospective study published this year, again by the EVI group, that suggests that when you compare cycles that have been run with either time-lapse microscopy approach or standard incubation, you have an improvement in a clinical pregnancy rate in a measure of, say, 20% in favor of time-lapse microscopy group. So this is a suggestion that the system may be beneficial, but per se the study is retrospective and cannot be considered conclusive. And again, the care group has also assessed this approach of embryo selection through time-lapse microscopy, and you see how, I mean, the data are quite clear. It seems that there may be an effect in older age patient comparing embryoscope and standard incubation, and this effect in fact disappears when younger patients are observed. And there is a study ongoing, prospective, in this case randomized trial by the EV group, but this is still ongoing, and I mean, final conclusions cannot be drawn, but there is a suggestion that there may be an effect of time-lapse microscopy for selecting better quality embryos. But all these studies have the bias that are not able to discriminate whether a possible positive effect of time-lapse microscopy is due to a better morphokinetic criteria for embryo selection, or in fact a better incubation condition, which are in fact assured by this kind of instrument. So the conclusions are that, of course, time-lapse microscopy is allowing us to see embryo development with brand new eyes. We've seen things that we could only dreamed only a few years ago. So we have lots of food for thoughts for a better understanding of embryo development in vitro. But we need to be careful because there may be bias due to the technology, due to other influences that we can introduce with the manipulation. And so what we can see is that there are suggestions that we can predict embryo blastocyst formation, blastocyst quality haploidy, but these are only limited data that have to be confirmed. The same kind of conclusion may be applied to the clinical outcome. There is suggestion that it may work, but we don't have a definite answer yet. Thank you.